Brain injury can happen to anyone. There are almost 500,000 people living in Ontario with a brain injury. Acquired brain injury, or ABI, is 15 times more common than spinal cord injury, 30 times more common than breast cancer, and it is 400 times more common than HIV/AIDS. Furthermore, brain injury is the leading cause of death and disability for those under the age of 45. Yet, in spite of these staggering numbers, there is still a lack of awareness about what a brain injury is and its consequences. Brain injury can happen in one of two ways: through a traumatic event or what is defined as a non-traumatic event. With a traumatic event, damage to the brain is caused by an external physical blow or shake. An example of this may be a motor vehicle collision, a fall, severe shaking such as shaken baby syndrome, or through physical assault, including domestic violence. It may also be caused by a sports-related injury. Brain injury can also be a result of a non-traumatic event. This includes diseases that can cause damage to the brain, such as meningitis or encephalitis. One can also acquire a brain injury through anoxia, which is a lack of oxygen to the brain. An example of anoxia may be a near drowning or a cardiac arrest. Also, a brain injury may occur where there is disruption of blood supply to the brain, such as a stroke or an aneurysm. Many people do not understand the full complexities of a brain injury until it happens to them or a loved one. The first myth: all brain injuries are the same. The fact is that no two brain injuries are alike. The brain is a very complex organ, and brain injury is not like any other disease or injury. For an example, if someone breaks their arm, the diagnosis, the prognosis, and recovery time is generally straightforward. However, with a brain injury, it depends on the severity of the injury and the part of the brain involved. Every injury is unique, therefore recovery and consequences vary. The second myth is that all brain injuries heal with time. The fact is that once a neuron's nucleus is damaged, that neuron dies. The damage is permanent. However, the good news is that the brain is capable of neuroplasticity, which means that sometimes the brain is able to make new connections to compensate. A third myth is that a good physical recovery indicates that the brain has healed itself. The fact is that some survivors with severe brain injury show no outward physical signs of impairment. Cognitive abilities such as memory, abstract thinking, attention, and judgment can be seriously or permanently affected in the absence of physical injuries. This is why brain injury is often called the invisible disability. I think of Tom, a survivor of brain injury, who describes so eloquently what it is like to live with this invisible disability. Tom shared, "I walk fine, I talk fine, and I appear normal in every way, yet the symptoms I experience have made it impossible to return to my job as a teacher." He goes on to say, "I sometimes wish that I was more severely injured so that people could see my injuries." This is what many survivors of this invisible disability feel and have to face each day. If you or your loved one has sustained a brain injury and would like more information or need support, please contact the Ontario Brain Injury Association at 1-800-263-5404 or email support@obia.on.ca. OBIA has been supporting families for over 30 years, and we are also here to help support you in your journey after brain injury.